This is Dr. Jerry Hesch from the Hesch Institute in Aurora, Colorado. I treat the person, I treat the nervous system, and I treat movement. This is a demonstration of somebody who has compression of both acromioclavicular joints. The way that I test that mobility, I actually test several movements, but I especially test oblique distraction this way. And a normal person, you'll be able to push the shoulder to a stop point, but then you'll be able to spring it and it'll spring further outward and it'll recoil backwards. In this example, the slack is taken up quickly. And now I'm trying to spring it. Do you feel me trying to make that bounce? Mm-hmm. Okay, I'm doing these thrusts. Do you feel each thrust? Mm-hmm. Okay, but there's no movement there. Okay, so of course your pectorals are tight, but massaging the pectorals isn't going to fix this. Okay, mm-hmm. And of course anyone involved with posture would say, oh, you have rounded shoulders, you got to walk with your shoulders back, but you can't move them back. Mm-hmm. They're restricted in this joint. Mm-hmm. Okay, can we have you roll towards me and lay on your stomach? All right, now what that does is it lengthens the posterior musculature. And so they have weakness. They are also inhibited neurologically because of the tight ligaments. It facilitates the type 3 mechanoreceptors called Golgi tendon-like receptors, mechanoreceptors. And you could do all the strengthening in the world. I mean, you're a strong person. You've done exercise for how many years of your life?
Since I was a teenager.
Since you were a teenager. And yet, let's see what happens when we test your strength. So lift your arms up sideways. So at a pure 90, good. And then bring them up towards the ceiling, good, beautiful. At the count of 3, don't let me push them down. 1, 2, 3. Easy to break. Okay, that's an inhibition. Okay, so strengthening is not the answer to that inhibition. Restoring mobility in the AC joint is the answer. Okay, so I'm going to demonstrate on the skeletal model before I treat you. The technique that I use is to capture, I'm working on the left scapula, to capture the scapula and pull it laterally in the same plane as the scapula. So I just grab the medial border and pull it till movement stops, okay? And then with my other hand, I walk up the axillary line and I fall down on the acromion, and then I push the acromion obliquely. Okay, so the direction of force on the acromion will be here. So it looks like this, and then it looks like this. And I do that for 2 minutes. Alternately, I can have the patient treat themselves, and I can have her lay on her stomach and simply put this 2-inch tall foam or a rolled towel obliquely under the shoulder. And it works. It works beautifully. So what I'm going to do is I'm going to treat her for 2 minutes with my hands, you know, doing the work. But then I'm going to have her lay on her stomach and put the foam underneath as well. And I think you'll then be able to see that both techniques are very effective. So I'll stop filming now and we'll film the results.